I take this opportunity of wishing you all a very healthy and a safe day. Though I am a urologist and a kidney specialist, I am a healthcare worker at heart. In these challenging times, let me share something which will help us all to be physically and mentally strong. I always believe challenges are always opportunities. So, if you don't come out of this lockdown with a new skill, more knowledge, better health and fitness, you never lacked the time. You just lacked discipline. This lack of discipline hit me where it hurts the most. I dusted my library, selected few fictions and non-fictions that occupied my afternoons. I undertook a given to gain my knowledge. I undertook a quest to gain more knowledge. The chessboard became the cynosure in the drawing room, and the chess pieces found their positions of glory. I was on a quest to gain a new skill. What came handy was my medical training. How? Many medical conditions have multiple options. After explaining all the options, one zeroes down to the one option that I would like to opt for myself had I the same ailment. That is, put yourself in the other person's shoes. And this is what is chess all about. Think from the other person's viewpoint. You will never go wrong. I also put to test my culinary skills, digging out my collection of classical, traditional and exotic recipes. This turned out to be a great family activity, an excellent stress buster. My kitchen garden and lawn took up my morning hours. New ideas implemented, and it was great to see life in different forms. The treadmill, the cross trainer, Smith machine, and other sundry found a new role avatar. I spruced up my whole home gym with the Bluetooth speakers at strategic locations. My gym lessons were followed by yoga asanas for flexibility, stretching and relaxation. Woof! So many activities, so much to do. I just wonder, how can someone not enjoy this lockdown? This is the first summer vacation after schooling. Are there any repercussions on urological patient outcomes for delayed treatment? Yes. Time and tide waits for no one. So true for a lot of medical conditions like kidney stones. Pain comes at the most unexpected of times. Body gives indications called symptoms, which one must never ignore or postpone. Be it corona or no corona, body will keep giving signals up to a limit. If you delay medical attention, attributing to the lockdown, the body will ultimately stop giving these signals, leading to silent progression of the disease, resulting in irreversible and irrevocable damage to a genitourinary symptom. Stones causing obstruction can lead to hydronephrosis, that is swelling in the kidneys. Stasis of urine can progress to febrile UTI, and its consequences like pyelonephritis or pyonephrosis, that is pus in the kidneys, more so in diabetics. Ignoring obstructive urinary symptoms can gradually progress to a chronic bladder and bladder failure, even chronic renal failure. These all become irreversible and have a permanent damage in our organs. Urinary bladder cancer has intermittent painless hematuria, so easy to ignore. So goes with other cancers of our genitourinary system. Delaying medical attention can lead to progression of cancer from early stage to advanced stages. Testicular torsion, in which there is sudden pain in the scrotal area without any urinary symptoms or fever, is an utmost emergency. Any delay or more than 6 hours can lead to testicular loss. Penile fracture, a sudden click like breaking sound during passionate sexual act, along with swelling and discoloration of the skin, is an emergency. Any delay more than 6 hours can cause permanent impotency. Hernias are swellings, commonly in the groin area, which reduce on lying down and gentle pressure. Not able to do so is initially a sign of possibly irreducibility and later on an obstructed hernia. This is another emergency. Sooner tackled the better. AKI, acute kidney injury indicated by decreased output of urine is an emergency. Not tackling on time can lead to CKD, chronic kidney disease. Do patients suffering from urological disease have a higher risk of COVID-19? Any disease in our body is a result of our decreased immunity and resistance to fight it. Patients with chronic kidney or urological conditions like CKD, especially with diabetes, are most vulnerable. Patients with urological cancers, say of the kidney, prostate, bladder, testis, penis, etc., are already immunocompromised, especially if they are on some form of chemotherapy and they are all stressed, which is a great immunity depressor. Patients on tubes and catheters are prone to infections, which again decreases our immunity. So this brings us to the most important question: how to be safe? Immunity. More immunity and more immunity. But how? The first part of my talk explained it all in a nutshell. Gain more knowledge, reading, writing, painting, quizzing, puzzling, etc. Try a new skill. Sketching, karaoke, cooking, photography. Third, better health and fitness. Gardening, yoga, home gym, etc. To top it all, balanced nutrition, diet, early dinner and a sound sleep. So guys, friends, wishing you all a great immunity and a robust health. This is Dr. Rajesh Gulia, Director and Head of Urology and Renal Sciences, Mayo Hospital, Mohali, signing off.